Welcome back to downtown Seattle. We're here at the Convention Center and in for the 27th Annual Alzheimer's Association Regional Conference. It's been a fascinating day so far, learning so much and hoping again that you're getting a lot out of the many guests that we've talked with already during our time here today. Another one has just filed in, victim number 5, I think it would be actually. I hope Ken Sterner's keeping track behind the camera today. With us right now, Lindsey Beach. Lindsey is with the University of Washington Alzheimer's Research Center. She is the Education and Outreach Coordinator there. She's going to talk to us more about her role and also about what the center's role is and what they are doing right now in the field of Alzheimer's research. Lindsey, thanks for the time. Appreciate it.
Thank you for having me.
It's obvious why you are here today. If you are working in the field of Alzheimer's research for a research center that's university-based here in the Puget Sound region, obviously this conference is a must-attend for you.
Yeah,
have you
sure.
attended this every year that you have been with the center?
I have, yes, yeah.
Okay. And that is how many years now?
I've been with the center for 3 years.
Okay. What brought you to the center? You seem awfully young to be involved in something like this, but is there a personal story, a reason why you got involved with Alzheimer's research?
Frankly, I just thought it was a really great way to kind of be exposed to the research community and also give back in a way that was really practical. Personally, I don't have any family members that are affected by the disease, but I've learned a lot of the different stories from our participants and their family members, and it's a pretty devastating situation for most everyone. So it's been a great opportunity to learn more about the disease and specifically about the wonderful researchers who are spending so much time trying to find out more and solve the puzzle. So
yeah, and it's quite a conundrum, I know. We've heard a lot about it today so far.
Yeah.
I know we're going to hear a lot more as the day progresses, but the Center for Alzheimer's Research at the University of Washington, do you know how long it's been there exactly, Lindsey? Or?
Yeah, so it's been there over 25 years. We've moved to a few different locations, but we've got quite a long legacy of Alzheimer's research in the Pacific Northwest. So we've looked at different things over the past 25 years, anywhere from different clinical trials, studies on supplements that may or may not be useful for treating Alzheimer's disease. And our center really focuses on research biomarkers. So those are different proteins that may be indicators of who in the future might go on to develop Alzheimer's disease, or how significant the brain changes of Alzheimer's are in individuals. So we do lots of procedures called lumbar punctures, and we've developed, it's commonly called a spinal tap, which is pretty scary to most everyone, understandably. But we've really changed and revolutionized the procedure, and we have low rates of headaches afterwards, and most people have a good experience. So yeah, our center's been around for quite a while, and a lot of our researchers have been there for over 20 years. So there's quite a wealth of information and knowledge with the data we're collecting, and also the faculty members that work at our center. So.
Wow, that's great. How many folks go through the clinical trials every year approximately? You have any idea?
We have about 350 participants in our research registry, which is kind of a pool of people that get a checkup once a year, and we give them a thorough evaluation, and it's kind of a wait list per se of people who may be eligible in the future. And then depending on different clinical trials, it depends on how many people the trial wants. So we have a trial right now that's looking for 100 participants, and I believe we've got about 50 enrolled in that one. And then we've got smaller clinical trials where we only have a handful of people, but they're a little bit more intensive and they require people coming in quite frequently. So yeah, so it really varies. But anywhere from 350 with our registry up to maybe 500 overall with all of our different clinical trials. So.
Okay, so quite a few folks that are brought in for the clinical research portion of this, and not all of them who have Alzheimer's or have experienced the symptoms of Alzheimer's, but again, folks that could be within groups where genetically they would be predisposed to getting this at some point, more so than another down the road?
Yeah, we do have a genetic component to our research center. So people who might have an extensive family history of Alzheimer's disease in their family are of particular interest to us. And ultimately the goal is to prevent Alzheimer's disease from ever happening, because prevention is way better than a treatment, because then you never get it. So we are looking at what we call control subjects, which are people with little to no memory concerns or no forms of dementia. One of our studies is actually looking for prevention, a possible prevention strategy. So yeah, we look for people across the Alzheimer's spectrum. So people who are unaffected, people with mild cognitive impairment, and then we also have some studies for people with more severe dementia.
Okay, and the studies that are going on right now at the University of Washington Research Center involve what?
So we have two primary studies that are happening right now. We have one called the SymBio study, which is looking at simvastatin or Zocor as a potential prevention medication, potential prevention treatment. And the lead researcher on that, her name is Gail Lee, and she's an epidemiologist. So she took this group of patients at Group Health and looked at them over the course of about 10 or 15 years to see if there's any patterns in who developed Alzheimer's disease, when they developed Alzheimer's disease, and then also the people who didn't. And she noticed that there was a relationship between the individuals that took simvastatin in early life, which is 45 to 64, that they had lower rates of Alzheimer's disease in later life. And so she is going on to explore this idea to see if there is a relationship between taking simvastatin in early life and potentially preventing the occurrence of Alzheimer's disease. So she did a small clinical trial, and the results looked good, and so we're doing a larger study now. And then the second research study we're doing is looking at an over-the-counter medication called prazosin, and the director of our center is developed prazosin as a treatment for trauma nightmares in veterans with PTSD. And what it does is it reduces the level of brain adrenaline. And so with Alzheimer's patients who are really agitated and confused, might have combative behavior, and just generally not very happy, they can go on prazosin or placebo, and they meet with our doctors and can go through our center. And we've seen some promising results with that. One of the great things about prazosin is it's 5 cents a pill, so it's not really cost prohibitive for most people. And it's also non-sedating. Most of the Alzheimer's drug medications for agitation are basically antipsychotics, and so they kind of knock people out rather than actually treating the brain chemistry that's going on. So those are the two things we're looking at. We're also doing lots of lumbar punctures and doing research on biomarkers. That's kind of our clinical trials landscape right now.
Wow, sounds fascinating. It sounds like some good things are coming out of them. One of them being that there is at least one place in the world that still defines 45 to 64 as early life, which I'm very happy about, by the way.
People like that.
Got to keep that in line for sure.
Yeah.
So, Lindsey, in addition to the drugs and some of the more technical speak, I suppose, that folks might not understand, again, you did a great job of filling us in and letting us kind of understand more about how those medical trials are run. But are there any things that are being looked at from a practical standpoint, like diet or exercise, how those things have an effect on Alzheimer's or the potential to contract it in the future?
Mm-hmm. Yeah, so I think, as Dr. Gary Small spoke about earlier today, lifestyle interventions and lifestyle treatments are really, really important because genetics do play a role, but what you eat and how active you are and how socially active you are really important. So our research center doesn't really specifically focus on that, but the Memory Wellness Center, is our friend research group. They do quite a lot with the nasal insulin study, looking at diet and exercise and seeing how that affects changes in the brain. But I think one of the basic things we know at this point is the rule of thumb is what's good for your heart is also really good for your brain. So common things like keeping your cholesterol at a good level, making sure your insulin, if you have diabetes, is well controlled and well monitored. Also exercising quite a bit, both doing cardiovascular exercise and weightlifting and different things like that is really important. So as our researchers say, it's all the really difficult, boring things that you've been told multiple times to do and can be kind of guilt-inducing, but we're finding out that yeah, most of the things that are pretty good for the heart are also pretty good for the brain.
So again, one of the things we continue to learn here as we talk to everybody, regardless of whether they have a medical background, whether they have a background in work at a research center like Lindsey does, or perhaps even in some form of government, is the fact that mind and body are really connected, and we all need to remember that all the time for our wellness, in particular as it is pertaining here to Alzheimer's health in the future.
Yeah, for sure.
Very good. Lindsey, and your particular interest does not lie in either the medical profession or in anything that you might think of. What it is that you want to go on to do exactly?
I'm going to go to the University of Washington for graduate studies in sociology. So, yeah.
Very good. And this is a great in for that, because obviously these are social studies, and you're learning a lot in your chosen field in the future?
I am, yeah. I actually... before I started at the research center, I would say that I had a mild interest in things medically related, but now, after being here for a few years and seeing how, just how intimate medical issues are to people's lives, and how big of a need it is to have wise policy, different things like that, I'm going to be focusing some on medical research in my sociology work as well. So.
Excellent. And certainly, sociologically speaking, this is a disease, much like so many of them, but Alzheimer's, again, touches so many folks within a family and within our society. So that's obviously something that you have to be keying in on as far as where you want to help in the future, the work that you do too. So, Lindsey Beach, appreciate the time, and the best of luck to you in the future.
Thank you. Thank you so much.